Welcome. My name is Brittany Provost. This is the Health Insurance Education Series, and this series focuses on Medicaid waivers for this year. We have some representatives from the Department of Rehabilitation Services, DRS, here with us tonight to present. So I will turn it over to them shortly. And just a little bit about DSCC, since DSCC is hosting this webinar series. We're not presenting tonight. Like I said, we're going to turn things over to DRS soon, but if you're not familiar with DSCC, I wanted to share our vision and our mission. So our vision is that children and youth with special healthcare needs and their families will be at the center of a seamless support system that improves the quality of their lives. And our mission is that we partner with Illinois families and communities to help children and youth with special healthcare needs connect to services and resources. And one of the big ways that we do that is with presentations like this, giving all of you in the community, you as families or professionals, the information directly. All right, Molly, I am gonna hand it over to you.
Good evening, everyone. My name is Molly Chapman. I'm the Assistant Bureau Chief of Program for the Home Services Program. We're part of the Division of Rehabilitation Services, Illinois Department of Human Services. With me this evening, I have three of our program managers, Garland Burt, Jenny McGee, and Eric Hansen. I will be your primary speaker this evening, although the managers may jump in if I need a little help, as well as assist with answering any questions that may come in on the chat or Q&A. The Division of Rehabilitation Services is the state's lead agency in providing services to individuals with disabilities. DRS works in partnership with people with disabilities and their families to assist them in making informed choices to achieve full community participation through employment, education, and independent living opportunities. Employment services are provided through the Vocational Rehabilitation Program. Educational services are provided through Illinois School for the Deaf, Illinois School for the Visually Impaired, and Illinois Center for Rehabilitation and Education. Independent living opportunities are provided through Illinois Centers for Independent Living, or CILS, and the Home Services Program. Displayed on your screen is a map of all Illinois counties. It is broken into 5 different regions, and within those regions, DRS has 48 local field offices. 15 of those offices are within Cook County, and those are displayed in yellow. 10 of the offices are in the Chicago suburbs and northern Illinois, and those are displayed in green. 8 offices in Region 3 displayed in a light blue from Rock Island to Quincy and then all the way to the east. And then in the central part of the state, represented in purple, we have 6 offices. And then the lower or southern portion of Illinois has 9 offices, and those are represented in pink. The Home Services Program provides services to individuals with significant disabilities so they can remain living in their homes as independently as possible. HSP is based on an independent living philosophy, which is the idea that a person with a disability is the best expert of their own lives. They have crucial and valuable perspective to contribute, and they're deserving of an equal opportunity to decide how to live, work, and take part in their communities, especially in relation to those services that powerfully affect their day-to-day lives and their access to independence. Now, HSP supports eligible individuals both with and without Medicaid coverage. Eligible individuals that have Medicaid will be enrolled in one of three 1915C home and community-based waivers operated by DRS. We have the Persons with Disabilities waiver, which is for individuals who are under the age of 60. Persons with brain injury waiver are for individuals of any age who are diagnosed with a brain injury. Persons with HIV/AIDS waiver are for individuals of any age who are diagnosed with human immunodeficiency virus or acquired immunodeficiency syndrome. Eligible individuals that have been denied Medicaid access are 100% state funded. Now, all three waivers and those persons that are 100% state funded collectively are what we refer to as the Home Services Program. They're all eligible for the same array of services. There are a few differences in the brain injury waiver and the HIV/AIDS waiver that I'll cover later on in the slides. So eligibility criteria for HSP. Must be a U.S. citizen or a legal resident. Have a severe disability lasting at least 12 months or for the duration of life. Require services that cost the same or less than nursing home services. Be at risk of nursing home placement, and that is measured by scoring a minimum of 29 points on the determination of need. Be under the age of 60 at the time of application, except for those with diagnoses of HIV/AIDS or a brain injury. Be a resident of Illinois. Have less than $17,500 in non-exempt assets for customers under 18. I'm sorry, for customers 18 and older, or $35,000 in family assets for customers under 18. Have applied for, be a recipient of, or be found eligible for Medicaid. So as I said on the earlier slide, HSP does support people who do not have Medicaid. However, the important piece of information there is that individuals do have to apply. So they have to apply, but if they're denied Medicaid and they're otherwise eligible for HSP, we will still support them. Every year at annual redetermination, they would be requested to reapply for Medicaid. So becoming an HSP customer. The next slides, I'm going to review the different steps a person needs to take to become an HSP customer. And then also we'll talk about a little, some of the information that happens after a person becomes eligible. So we're going to cover submitting a referral, the eligibility interview, the determination of need, or DON as we refer to, DON assessment, service cost maximums, and service planning. So how to make a referral. First off, anyone can make a referral. Probably the easiest way is to go online via the DHS website. I have the link displayed on your screen, www.dhs.state.il.us. And if you go to that site, you're going to look for rehabilitation services and then apply online. You can also submit a referral by contacting your local HSP office by phone. If you don't know where your local DHS office is, you can go to the office locator that's on the DHS website, or you can call DHS's toll-free number at 1-800-843-6154. DRS also has a toll-free number, and that is 1-877-581-3690. Displayed on your screen, you'll find an image of the DRS online referral. We refer to them as web referrals. At the top of the referral, you'll see two checkboxes. This referral you can use to submit for both HSP and vocational rehabilitation services. We refer to that as VR. So for VR, you would check, I would like help getting or keeping a job. And for HSP, you would check, I would like help living independently at home. You can submit a referral for one or both programs at the same time. The largest part of the referral is going to be your basic identifying information. First name, middle name, last name, gender, date of birth, basic demographics. Now, not all fields are required. However, if you have all the information, the more information you enter, the easier it is for us to contact you. Many of the fields have drop-down boxes where you'll make a selection from a predefined set of options. You enter an email address, you'll receive a confirmation email once your referral has been submitted. And then once it is submitted, those web referrals are assigned to a local office closest to the customer's residential address. So the eligibility interview. Customers who have submitted a referral will be contacted by HSP local office staff to schedule an eligibility interview. Now, all customers are required to participate in an interview and assessment with an HSP counselor. The great majority of those interviews are being conducted over the phone. There are some circumstances where a counselor would go into your home in order to conduct the interview and assessment, but the great majority of the initial interview is done over the phone, and then you would have a follow-up home visit that would be completed afterwards. So during the interview, the HSP counselor is going to obtain information from the customer in order to complete the Home Services Program application. They will administer the determination of need assessment, and then they will work with the customer to gather the required documents needed to finalize and determine whether or not the customer is going to be eligible for the program. The determination of need assessment, we often refer to that as the DON assessment. It covers activities of daily living and instrumental activities of daily living as performed in the customer's home. There are 15 different areas that are covered. There is one area that is outside the home, but again, the remainder of those are covered with how the customer is able to go about their day-to-day activities living in their home. Scoring is based on the customer's responses, observation, evaluation, and report of others. For children, that is quite often the report of their parents. However, customers do have the right to have anyone that they choose involved in their eligibility interview and assessment. We have many adult customers who will conduct and complete the interview and assessment on their own. They may choose to have someone with them to assist them, possibly a friend or spouse. But it really is the customer's choice as to who would be involved in their interview and assessment. The determination of need is composed of 3 different components. The first one is the full-steam mini-mental state examination, or the MMSE. The impairment which is a measure of a customer's functional ability, and then the need, which is a measure of their available resources to assist them in the areas where they're unable to assist themselves. Now, parental responsibility and a customer's age are considered when administering the DON to persons underneath the age of 18. So as I said, there's 15 areas addressed within the determination of need. That's eating, bathing, grooming, dressing, transferring, incontinence, money management, telephoning, preparing meals, laundry, housework, outside the home. Now, outside the home activities could be things such as grocery shopping, going to medical appointments, banking. There's routine health, special health, and then being alone. So depending upon the way the determination of need is scored, a person could be either eligible for, they'll either have formal eligibility, which means they would be eligible to receive all services available within the home services program, or they could be eligible for respite services. Now, for formal eligibility, a person would have a minimum of 29 points. And those 29 points would be split, or the minimum would be split between the MMSE, impairment, and need. Again, for formal eligibility, there would have access to the full array of HSP services, which would be detailed within the service plan. Now, they could also just be eligible for respite services. If the DON is scored to where there's a minimum of 29 points in the MMSE and impairment, and then 0 or no points in need, then a person could be eligible for respite services. Respite services means the individual could use up to 240 hours per year. Now, respite is defined as temporary care for adults and children with disabilities aimed at relieving stress to families. Respite services may be provided for vacation, times of rest. If the primary caregiver needs to run an errand, if there's some type of family crisis or other emergency. And services could include those provided by a personal assistant, a homemaker, or a home health agency, and that's going to be your nurses. So service cost maximums are monthly spending limits. They are based on 7 DON point range groupings. The total monthly service plan costs must fall within the range corresponding to the customer's total DON score. Now, customers will not automatically receive the maximum amount allowed within the range of service cost maximum. That is going to be determined in the service planning process, which is a discussion that would occur between the HSP counselor, the customer, and their representative. It is based upon the needs or the impairments and needs as identified within the DON assessment. The service cost maximum limits are analyzed whenever we have a provider rate increase. And we will increase the SCMs utilizing a waiver amendment to ensure that customer services are never reduced due to a provider rate increase. Within HSP, we have set rates for all of our different provider types. Some of our providers are unionized, and so those provider rates are set through collective bargaining. And then respite customers will receive 240 hours per year. Respite services are not going to be subject to the service cost maximum. They are going to strictly be set based upon 240 hours. And they could use any different type of provider as agreed upon in the service planning process with the counselor. And again, that's going to be driven based upon their DON assessment. So here displayed on your screen are our current service cost maximums. These are effective January 1st, 2025, which is when we had our last rate increase. Over on the left-hand side, you'll see the different point counts, which is representative of the DON point range. It starts at 29, it goes all the way up to 100. The middle column is going to be the service cost maximum for those persons who are in the Persons with Disabilities waiver. Now, the brain injury and the HIV/AIDS waiver, they have a little higher service cost maximum amount, and that is to account for a few additional services that are available to people within those waivers. Service planning. So DRS, HSP staff conduct eligibility interviews and assessments for everyone who submits a referral. If the person is determined eligible, if they are a Medicaid recipient, and if they're currently enrolled in managed care, they will then be contacted by their MCO care coordinator for the service planning process. Currently, about 70% of HSP customers are enrolled in managed care. So 70% of our customers will have the service planning and waiver oversight done by an MCO care coordinator. So that would leave about 30% of our customers that would continue to work with that HSP counselor for service planning and case management. So everyone, all HSP customers, eligibility is determined by an HSP counselor. They're going to do your initial interview. They're going to administer your DON. They're going to determine whether or not the customer is eligible. Then once eligible, if they're with an MCO, that MCO care coordinator is going to take over care of their service planning and oversight of their waivers. And then once a year, that MCO HSP customer would be contacted by the HSP counselor to do their annual redetermination of eligibility. It can get a little confusing sometimes. That's why I wanted to say it a different way. The remaining 30% of HSP customers who are not in a managed care organization, they will only work with their HSP counselor or other HSP staff for their annual eligibility determinations for their service planning. So the HSP counselor or MCO care coordinator will work closely with the customer and their representative to develop a safe and adequate service plan. The service plan details the services, the level of service provider, and the monthly hours available to the customer. Now, it's based on the customer's impairment and need scores in the functional skill areas of the DON. And the level of service provider may be based on that, as well as the tasks within the service plan. And when I say level of service provider, that could be a personal assistant or a homemaker, or it could be if someone needs more skilled nursing care. So they may need services by a CNA, an LPN, or an RN. Most services are provided in the home while the customer is present. The only time this isn't going to be true might be if the provider is doing grocery shopping, or maybe they're been trusted to do some banking within the community. Now, they may assist the customer at a medical appointment, which of course could be in the community, and of course the customer would be present. So those are a couple examples of when services might not be provided in the home, and then just a couple examples of when the services might not be provided when a customer is present. However, all the services, all the services that are going to be provided in the home, the customer would need to be present for those services, which is the great majority of what HSP provides. And then there is the annual redetermination of eligibility and then annual service planning. So most HSP customers utilize individual providers for their in-home services. Individual providers, or we refer to as IPs, they are the self-directed model. They are employed by the customer. So the customer is responsible for selecting, scheduling, evaluating, training, disciplining the individual provider. DRS, so we act as a fiscal intermediary, which means we're going to process the payroll. We'll issue the paychecks. We work with the provider union, and a handful of other functions that is necessary in order to pay the bills would be the easiest way to understand our role. The customer or their representative must be able to direct their care. Not every HSP customer is going to go with a self-directed individual provider model. And sometimes it's because they're just unable to direct their care. They're unable to manage and take on the responsibility of employing that individual provider. Now, all individual providers are Medicaid providers. They must comply with all HSP paperwork and policies. Individual providers can be personal assistants or they can be nurses. So an individual provider could be a CNA, an LPN, or an RN. They're going to assist the customer with completion of activities of daily living and instrumental activities of daily living as listed on the service plan. So the different areas that a customer needs assistance with is going to be listed on the service plan, as well as the provider type, and then the approximate number of hours a customer would receive in each of those areas throughout the month. Individual providers cannot transport customers for any reason. Now, for those who are not able to direct their own care, or sometimes they just choose that they don't want to, we have agency providers as an option. Now, with agency providers, the worker is employed by an agency. The agency must be approved by DRS, Home Services Program. Agencies could be homemaker agencies, and that's where you're going to have your personal assistants or your homemakers. They could also be home health agencies, and those are going to be your CNAs, LPNs, or RNs. Customer choice of provider is not guaranteed with an agency, so you're not always going to get to decide who's going to come into your home and assist you. But again, as with the individual providers, agency providers cannot transport customers for any reason. So legally responsible individuals are what we refer to as LRI. So an LRI is defined as a customer's spouse, a parent, step parent, foster parent of a customer who is under the age of 18, or a legal guardian of a customer who is under the age of 18. An LRI can be paid to provide personal care services on the service plan when they meet the definition of extraordinary care. So those services on the service plan, which again originate within the DON, that meet the definition of extraordinary care are eating, bathing, grooming, dressing, transferring, incontinence care, routine health, and special health. An LRI will not be paid to provide services for any of the following services on the service plan, and that is money management, telephoning, preparing meals, laundry, housework, outside the home, or being alone. The LRI must meet all IP requirements as well as additional LRI requirements such as increased home visits, independent adult third-party approval of timesheets, and a lower weekly working hours. LRI cannot work for an agency provider or for customers with respite services. So LRIs can only be individual providers, and that is the self-directed model that I talked about. LRIs cannot work for customers who have only been approved for respite services. When an HSP customer chooses to and is approved to hire an LRI, their service plan will have a couple additional pages, and we refer to those as the LRI service plan agreement. That service plan agreement will have the exact number of hours that the LRI is approved to work, and that's going to come from those tasks, the personal care services on dot point number 2 on the screen. Whatever those total, so long as they're not over 40 hours per week, would be what an LRI was available or had available to work. That dot point when it says lower weekly working hours, because there is a maximum cap of 40 hours per week for LRIs. So that amount will be very specifically listed on the LRI service plan agreement. Additionally, those customers are going to get additional unannounced visits throughout the year to the customer's home to check a variety of areas. There are several other requirements for LRIs, and all of those are detailed on that service plan agreement. So if a customer is able to hire an LRI, all that information is very specifically listed on the service plan agreement and requires the appropriate signatures, as well as that of an independent third-party adult who will take on the responsibility to oversee that and sign the timesheets for the customer and the individual provider. So HSP offers several other types of services. I've talked about individual providers. I've talked about agency services. And now I'm going to talk about the other services that are available. These services, they all are counted towards a customer's service cost maximum. Adult daycare, and that's going to be the direct care and supervision of customers in community-based settings to promote social, physical, emotional well-being. That does include transportation to and from adult daycare locations. Home delivered meals. These are available to individuals who can feed themselves but are unable to prepare the food. Electronic home response, which is an emergency response signaling system to provide 24-hour coverage so the individual can alert trained professionals, hospitals, fire departments, or other police departments in case of an emergency. We do allow for both landline and cellular coverage of the electronic home response. Environmental modification. Now, these are services to physically modify the customer's home to accommodate a customer's loss of function in the completion of ADLs or IADLs. Examples would be minor remodeling, such as doorways, bathrooms. We could add stair lifts or ramps to a customer's home as well. And assistive equipment are items that are going to be necessary to accommodate the customer's loss of functioning and completion of their ADLs or IADLs. And items could be medical or non-medical in nature. Case management. Case management services are provided by a local community-based organization. The case management services are only available to those enrolled in the HIV/AIDS or brain injury waivers. And this is the one service that is not counted within a customer's service cost maximum. Now, the brain injury waiver has 4 services that are available exclusively to customers enrolled in the brain injury waiver. Now, brain injury, as defined for our program, are conditions that include traumatic brain injury, infection, such as encephalitis or meningitis, anoxia, stroke, aneurysm, electrical injury, malignant neoplasm, and toxic encephalopathy. Congenital disabilities, such as cerebral palsy or epilepsy, are not eligible diagnosis, nor are degenerative or neurological disorders due to aging. And a few examples could be dementia, Parkinson's, or Alzheimer's disease. So there are a few links that are here on the last slide. As Brittany stated, these slides will be available on the DSCC website, so you'd be able to go there and click on the links for more information. For the general information for rehabilitation services, there's the link for the Apply Online, which is going to be the web referral system that I talked to you about, the office locator, and then there's also printable timesheets and provider employment packets. Of course, eligibility needs to be completed prior to that, but that link will give you a bit of idea of what's needed after a person becomes eligible and to hire an individual provider. So that is the end of my prepared materials for this evening. I see that there are a few questions in the chat, and I think that some of them have been answered already by Garland and Jenny, and Garland has come on the screen, so that usually means that he has something to say.
Yeah, thanks, Molly. I think some questions I don't have a problem. I don't have a problem answering them in the chat. We've had a lot of good questions come in, and Jenny and I are firing away as best we can. I'll read one question though, and I'll just share some feedback. Um, the question says, "It doesn't seem fair that kids are assessed this way." Um, Essentially, the question is, why can't we assess kids like other programs? And I don't really know what other programs people are referring to, but I mean, we have a Don assessment tool. It's used by several waivers in the state. Um, we're not in a position where, oh, I'm sorry, I was supposed to read the entire question. Um, Okay, the question says, it doesn't seem fair that kids are assessed this way. It makes it impossible for little kids to enter the program, even if they have really major physical disabilities and require a lot of care? Why don't they assess kids like the other programs in ways that actually look at how much more parents have to do to care for them? Um, yeah, so I mean, we have 9 waivers in the state of Illinois. We happen to have the home services waiver that uses the termination of need assessment tool to find people eligible. Um, we can't say tomorrow we're going to change the way kids are assessed in our program. Um, th there have been efforts in past years to try to get a different assessment and tool in place that people think would be more appropriate. This is what it is. We do serve kids in our program, so the fact that we might not be able to make a 2-year-old eligible, but I mean, we have 12-year-olds and 5-year-olds and 17-year-olds. I don't really have a good answer, except to say that, we do what we can we have.
So we have some questions. I'm going to look at the QA and I'll go to the questions that are currently open. And I'll start up at the top. And the first one is, and then when I'm done with those, then I'll go to the chat. Or if you and Jenny want to pick out some from the chat for me to answer, we can do that too. So starting with the first one, my understanding is that you cannot get more than one waiver service. I have a child on the PUNS, but not receiving services. If home-based needs are needed now, can my child remain on the PUNS and get DRS's help with immediate needs, but still be eligible for PUNS later? This is a great question, and the answer is yes. If you are on the PUNS list, you can remain on the PUNS and you can still submit a referral for the home services program. If you're eligible for the home services program, you'd begin receiving services. And then when your child is selected from PUNS, you would have a choice to make. If your child was determined eligible based on their PUNS selection for one of the Division of Developmental Disabilities waiver, you would have to choose between the home services program and the services provided through the Division of Developmental Disabilities waiver. A person can only be in one waiver at a time. Okay, so the next question, is there an exception for children under 18 who have family assets over $35,000 similar to the Katie Beckett allowance in the IDD waivers? The answer is I'm not aware of any exception to the family asset limit for the home services program. Every waiver has different eligibility requirements. Each one of them is going to have some differences. I'm not aware of any exception process for that upper limit of non-exempt assets for children. Okay. If I have an interview scheduled, do I still have to fill out the paperwork application? When your interview is being conducted, the HSP counselor will assist you with the application. They're going to ask you questions. They're going to fill in some information. They will eventually get that application off to you to get your signature. Now, the application is different than the referral, okay? We still want you to submit the referral. Then you would have the interview scheduled, and during the interview is when you would have the application completed with the assistance of the HSP counselor. How long does it take to hear back after filling out the online intake or online referral? So there is no one set time. Different areas of the state have different demands, and referrals are going to be addressed in the order they're received. if you have your confirmation email after you've submitted your referral, you can always call the local office if you want to check in on the status of your referral. But there is no one answer that I can provide for how long it takes. Can you use multiple agencies for nursing since your hours aren't being met without conflict? So I'm not quite sure what the last part of that question means, where you state since your hours are not being met without conflict. But the first part of your question, it is possible to use multiple agencies to fulfill the services on the service plan. Now, I'll tell you, most people, most service plans that I see, they're able to be addressed with one provider agency. Now, the great majority of HSP customers, they use individual provider services. So we just have a small percentage, about 10% of our customer base, using agency providers. Is it possible to get HSP overnight or weekend services for children to stay home while the parent or guardian is away? So if a customer is approved for HSP services, the services that are being provided are meant to address the needs or the impairments and needs as identified in the DON. So if a customer has individual provider services, then those services would be scheduled by the customer, in coordination with, the parent or whomever their representative is. Your question, when I read it, is kind of touching on maybe respite services. And a lot of times, customers who receive respite services, their parents will utilize the respite services to assist for times when they're going to be away from the home. So maybe they're going to do grocery shopping, or they're going to go on vacation, or they've had some type of emergency. So they would use the respite services for that.
Molly, we probably have time for maybe one more question before we have to kind of
Okay.
wrap things up.
Okay. Another one says, my teen needs 24/7 care. Who can I contact to help me find services and guide me through the process? So, 24/7 care, that's a great deal of services that a person would need. I will tell you that is more of a rarity within the home services program. Our service cost maximums really aren't set in a way to accommodate, and nor is the program really designed to provide 24/7 care for any customer. Having said that, is it possible? Yeah, maybe, but that's really a individualized answer. As far as for the home services program, the place you would start would be submitting a referral.
That note that you just ended on with the previous question maybe is a good segue to kind of say that a lot of these situations and these questions might be very specific to, each individual, and that perhaps submitting a referral if they have any inkling that they might need services is probably a good place to start.
Yeah. Can I just have just one more minute? I
Yeah.
think someone again is asking about the asset limit for families,
Yeah.
over the 35,000. And it's a hard stop, right? That's what the asset limit is. It's listed within the waivers. It's what we have to abide by. It's similar to the questions and concerns people express about the determination of need. It's our eligibility tool. It's the eligibility tool that is used to design the program, and it's listed in the waiver. And we're definitely not on here to tell anyone how they should feel about that. And it's quite understandable that they could have some frustration if the person they've referred is not eligible based upon the determination of need. However, the reason why we have that assessment is really not one for any of us to answer. What we answer is just the fact that that is our eligibility assessment. And that's what we use to determine if a person's going to be eligible and to help folks understand what that assessment is. And that some persons will be determined eligible and others won't. And again, we definitely understand that there's some frustration about that. However, that is why there are different waivers available through the state. HSP is not the program for everyone. However, we're a really good program for those who are eligible and those who need it. And just encourage folks to get as much information they can about the various programs that are out there, and try to find the one that best meets the need of their child or loved one or even themselves if they're interested in submitting a referral for services.
Thank you. All right. Well, thank you to everybody who took their time to participate in our training today. And thank you to all of you, Molly, and the rest of the DRS team for coming and presenting and giving us all this wonderful information. We hope everyone found it helpful. I know that whenever I hear all of this information in these presentations, I always learn something new. It doesn't matter how many times I hear it. So it's a great thing to hear multiple times. All the materials and the recording is going to be posted on the DSCC website. So that's the link, and you'll get an email from Zoom, and it will have the link to go get the information on the website. When you close out of Zoom, there's going to be a survey at the end that pops up. We really appreciate any feedback that you had about the webinar, and there's an opportunity to provide some suggestions for future webinar topics. And we really want you to take an opportunity to do that. We're interested in hearing about anything. So it does not have to be health insurance related, but if there's a topic that you think would benefit you or families that you work with, we really want to hear about that. And again, this is a webinar series. So this is our second one for this spring. We've done them. This is our third year now. And so we do a series of 3 each spring. In March, we focused on the medically fragile and technology dependent waiver. And then in May, we are going to focus on the Division of Developmental Disability waivers. So if you want to go back, you can listen to the March recording and you can still register for the May one. And then finally, this is DSCC's contact information. So there's our phone number, our email address, and then website and social media. If you have any other questions or things that you wanted to communicate to DRS, feel free to submit questions to that general email and we can try to get them to the DRS team. But I also will encourage, if you have questions or think that you might be eligible or want to, seek services, to go ahead and submit that referral so that you can communicate directly with DRS about that in your unique situation. So thank you all so much. I hope you have a wonderful rest of your day.